Hello there, my name is the Hood Doctor. It's very good to meet you today. I assume you found out about me through a friend of yours or something like that. Yeah, that is typically how I get most of my clients. Okay, so there's no need to tell me your name. People, they come to me typically because they value discretion or because they just can't afford typical private healthcare. And I mean, who can in today's economy? Absolutely outrageous. It's outrageous, I say. Okay, right, so what do you need help with today? You need a dental checkup. A dental checkup. Well, I don't usually do dental checkups, but I can do them. I think I've got enough equipment here that I could do a dental checkup. That's absolutely no problem. So what, do you have a pain in your tooth or something, is it? Okay, well, we'll take a look at that today. Okay, first things first, I better get some gloves on. Okay, let's keep this hygienic. One moment. Okay, just 1 second whilst I get nice and comfortable. Okay, excellent. Now, the first thing I think you should do is open your mouth for me. Okay, open your mouth nice and wide. Okay, very good. Close your jaw now. Okay, open your mouth again. Close your jaw again. Okay, does that hurt? Does that hurt at all? No pain in the jaw, in the joint especially? No pain. Okay, that's excellent. Okay, now I want you to open your mouth, keep it open, and I want you to move your tongue from side to side. Okay, so just do that. It's a bit difficult with me with my balaclava on. Okay, but for you it should be easy. Okay, move the tongue to your left. Move the tongue to your right. Move the tongue to your left. Move the tongue to your right. Okay, very good. Any pain there? Was that difficult? No. Okay, and now again, open your mouth for me. Tongue up on the roof of your mouth. Down on the palate of your mouth. I think that's what it's called, isn't it? Palate. I think the bottom. Okay, up. Down. Up. Down. Okay, and how was that? Was that painful? No pain. Okay, excellent. Good start. Good start to the dental examination, I think. Now then, what I'm going to do is I'm going to use a tongue depressor to press down your tongue. That's what it's for, right? And then I'm going to look around inside your mouth. Okay, I'll probably use a light to help me to see in there. It's a bit dark in there, isn't it? A bit dark. Okay, so 1 second whilst I find a tongue depressor. Okay, excellent. I've got my little tongue depressor here now, and I've got my light as well. Look at that bad boy. Absolutely beautiful, right? Right, okay. Now, open your mouth nice and wide for me, please. Okay, that's good. And I'm just going to be placing the tongue depressor on your tongue, as you might imagine. You might imagine that, because that's what it's for, right? Okay, pressing down on the tongue. And I'm just having a little look inside your mouth with the light on the tongue depressor, okay? Just having a little bit of a look in there. Having a little bit of a look. Going to be shining around with the light. Shining around with the light inside your mouth. Oh, excellent. What a wonderful mouth you have. Gums are looking very pink there, which is perfect. It's not looking overly dry, which is very good indeed. Very good sign. You want to have a nice wet mouth. A lot of dental problems are actually just caused by having a dry mouth. Saliva keeps your teeth and the bacteria and the microbiome in your mouth good, keeps them good. Okay, put the tongue depressor back on. I'm just having a little look on the other side. side, okay? Okay, same sort of thing here. Just having a little look, okay? Just having a little look with the light inside your mouth. Just having a little look, okay? Nothing to be concerned about. Nothing to be concerned about, okay? Nothing to be concerned about. Just having a little look. Let me just have a little shine in and a little shine out. A little shine in and a little shine out. Okay, that's quite interesting to see there. Quite interesting to see. Okay, okay, absolutely marvellous. You've done very well so far. That's good. Good initial examination of your mouth. Okay, I do just need to make a couple of little notes regarding your mouth. Let me grab a pencil first. Okay, 1 second whilst I grab a pencil. By the way, do you like my pencil case? It's a dog. It's a dog, a little fluffy dog. Okay, I like my pencil case. Very good, I think. Very good. Oh, no, it's got stuck. Oh, there we go. Excellent. Looking for a pencil. Looking for a pencil today. This is good. This is a good pencil. Yes, it is excellent. Excellent. Okay, 1 second. I'll be back again in a minute. Okay, so I actually need to put the tongue depressor back in your mouth, okay? I'm going to use the same one because I don't have many of these, okay? Okay, this is the Hood Doctor. What do you expect? Okay, it's okay. It's your mouth. It's still hygienic. Still hygienic, okay? I'm going to put this in the mouth there. And now I'm going to use this pencil. I need to make a couple of little notes, okay? I need to make a couple of little notes. I think here is actually quite an essential and important place to make a note, right here. And then also here is also very important. Let me just try and make that as precisely as I can. Okay, so you have an important location here and an important location here as well. Okay, here and here, very important. And now, of course, as well, this is also another important location where I have to make a note. Okay, just a very quick note. Okay, so now we have 3 important locations here, here, and here. Okay, very important location. Important location. Important location. Okay, that's great. Okay, now I can use this later in my further pondering and examining. Okay, so that's essential notage that I've just taken there. Very good. Okay, 1 moment. Okay, now then it's time for me to do the classic little check of your teeth. Okay, this is what occurs at the start of pretty much every dental exam, right? We look in your mouth, we look at your teeth, and we use a number system to sort of rate all the teeth and their condition. Okay, so I'm using a light again. Okay, I'm not looking in that dark, cavernous mouth of yours without a light. Okay, open your mouth wide for me, please, wider than I can, with the balaclava wide as possible. Okay, very good. Okay, actually, let me get a little bit closer. Okay, so just looking in the mouth now. Okay, I can see here. Very good. Okay, that's like 2 1 2. Okay, got another 2 1 2. 3 1 second, I need to write those down on a clipboard before I forget. Okay, before I forget. Just need to get a pen very quickly. Get a pen very quickly. Okay. Very good. Right, now I need to make some notes before I forget those teeth, the condition of the teeth. Okay, what was that? So 2, 1, 2. 3, 3, 3. Is that correct? 3, 2, 3. Okay, very good. That's 2, 2, 2. And 3, 3, 3. 1, 3. That's 2, 2, 2. That was 2, 1, 2. And then 3, 1, 3. Okay, excellent, excellent. Right, now I need to use one of those special little dental mirrors tonight so I can see the backs of your teeth. Okay, where have I put that? Where have I put that? Just give me 1 second, okay, 1 second. Okay, excellent. Look at this little fellow. Look at this little fellow that I just found. Little dental mirror, look. It's got a light on it too. I put the light on, plop, and then helps me to see into your mouth. Looks a bit dirty, doesn't it, actually? Looks a bit dirty. Dirty. Just give that a quick wipe. Give that a quick wipe. Okay. That looks a little bit better. Looks a little bit better. Okay. So now I'm just gonna use this to look into your mouth. Okay, there you go. You can see your mouth there, can't you? You can see your mouth. Bit of a strange looking mouth. Let me put the light on for you. Maybe you see a bit better. You see a bit better there. You can see your mouth. Strange looking mouth you've got. Okay, I'm just going to use that now. I'm just going to use that. And I'm going to once again be rating your teeth, but this time we're doing the back sides. I like the back side. Okay, now let's have a little look, shall we? So what is that? What is that? 2, 1, 2. Okay. 3, 3, 3. Okay. Okay, good. What is that? 3, 2, 3. Okay. 2, 1, 2. 2, 1, 2. 3, 3, 3. 3, 2, 3. 2, 2, 2. 2, 2, 2. 2, 2, 2. 3, 2, 3. 2, 1, 2. 2, 2, 2. Okay. Okay. I see. I can actually see the problem tooth. Let me just quickly write this down. Write down the conditions before I forget again. Sorry, I can't talk before I write them down. Otherwise I won't remember. Okay, 1 minute. 1 minute. Okay, what was that? 2, 1, 2. 2, 2, 2. 3, 1, 3. 3, 3, 3. 2, 2, 2. 2, 1, 2. Okay, 3, 3, 3. absolutely must scrape it away. Otherwise it's just going to build up more and more, and it's going to get worse and worse, as you can imagine. Okay, as you can imagine, that's how these things work. Okay, so yes, let me get my little scraping tools. I think that's what I shall do next. That's what I shall do next, yes. And we'll scrape that black off immediately. Okay, so one moment whilst I find my little tools. Okay, I'm ready to scrape the black from your teeth. Now you can see my little tools. Looks a bit scary, doesn't it, actually? Difficult to focus on, isn't it? Because it's such a small object. But, you know, not to be too concerned, it's not going to hurt. I'm just going to be scraping the backside of your teeth. Basically give them a little bit of a clean. Okay, so I'm just going to begin doing that now, okay? Okay. And whilst I'm doing this, I'm just going to give you a little bit of a lecture. Okay, a lecture on your dental hygiene. Okay, basically what I want to ask you is, what the hell have you been doing? What the hell have you been doing? Have you been eating exclusively a diet of sweeties, is it? Sweeties. Pure sugar. Pure sugar, is it? Is that what you've been existing on for the last, 6 months? That is a question I'm asking you. No, you haven't been existing on a diet of just sweeties and sugar, okay? Well, I fail to see how that is possible, considering the state of your teeth. Absolutely dirty, absolutely foul they are. And your one teeth is basically so rotten that the only good course of action is extraction. The only good course of action is extraction. Can you believe that? Can you believe that? Okay, so what I want you to do in the future is improve your diet. Number one, okay, limit the sugar, please, limit the sugar. And maybe think about not drinking so much sugar either. And that's not just, Coca-Cola, things like that. That's also smoothies and fruit juice. If you do have smoothies or fruit juice, maybe use a straw and just suck it good, and then it will bypass the teeth and just go straight down the throat. You know what I'm saying? Straight down the throat. Okay, so maybe that's a good idea. Okay, keep the teeth nice and healthy, and maybe try eating some more vegetables. How's about that? Try eating a few vegetables once in a while. Something green and leafy, maybe. Okay, maybe have a glass of milk for some calcium. It's up to you, really. You can get calcium from other places as well, like broccoli has a little bit, I think. Okay, stuff like that. Consider that. And for cleaning, obviously brush your teeth twice a day. Obviously floss twice a day or once a day, if you can only manage that. A little secret that I like to give people is to chew xylitol gum. Xylitol gum, you might have to buy that online, okay, from Amazon or something like that. Amazon xylitol gum. It's XYLI no, it's XY xylitol. I can't remember how to spell it, okay? I can't remember how to spell it, but I'm sure you can find it if you Google it. Google it, okay? It's quite easy. Everybody's got Google. But xylitol gum, what it does is it even has the potential impact of reversing cavities, which sounds absolutely insane. But the xylitol, it's like a special sweetener from a plant, zero sugar, but it tastes vaguely sweet. But the compound itself changes the bacteria in the mouth. The microbiome makes it difficult for bad bacteria to survive, and it even has the potential to reverse, what are they called, cavities? I think that's what they're called. Yeah, I think that's what it is. Okay, give me 1 second now. I just need to really This might feel a bit intense, okay? Just bear with me. Is that okay? How does that feel? Okay, good, because I need to do it like 4 more times, okay? Okay, good. A couple more times now. Okay, a couple more times. Okay, once more, last one, okay, last one. Okay, there we go. Let me double check with the little mirror actually. Let me double check with the little mirror. There you go. There's a little mirror there, okay. Put my little light on, make it easy for me to see. Let's have a browse, shall we, in those teeth. How did I do there? Is that nice and clean now? So nice and clean. So nice and clean there. Oh, that's much better. Much better. No disgusting plaque build-up on the backs of your teeth. Now they actually look like teeth. They actually look like teeth. Excellent. Okay, now then. Now we come to the difficult part of today's dental exam together. It has to be done. It has to be done. I'm sorry. Okay, I am sorry. But I need to extract that tooth. That nasty little rotten tooth of yours. Nasty tooth. Nasty, nasty. Right. So, first things first, let me give you some of that numbing solution. And let's hope it actually works. Okay, 1 minute. Okay, I need to shake it up. Okay, shake it up. Shake it up. Shake it up. Shake it up. Okay, I think that's sufficiently shaken up now. Okay, right. And what we're gonna do, obviously, this is going in your mouth. Okay, give me a second. Okay, open your mouth. I'm gonna pour it in. Keep it in your mouth, okay? Don't swallow this. Do not swallow this, okay? Do not swallow it. Right. And now if you could swish it and maybe hold it in particular. This side, upper, what is it? Your left hand side, upper left hand side for you. Just swish this area with the numbing solution. Try and keep it in that area and try and hold it there for as long as you can, okay? For as long as you can, and then I'm going to ask you to spit that out. But keep swishing for just a little bit, okay? Just a little bit, swishy, swishy, swishy. A little bit of swishy, swishy, swishy. Swishy, swishy, swishy. Okay. There we go. There's a bucket for you. Have a little spit into there for me, please. Okay, good. Very good. Okay, so I'll wait a tiny bit of time. Okay, wait a tiny bit of time. Hopefully that takes effect. And then this area of your mouth should become numb. Should become nice and numb. Okay, and then how am I going to extract that tooth? Let me just see what tools I've got, okay? Okay, I think I'm going to have to use these pliers to extract that tooth of yours, okay? Because looking around, this is the best I have. This is the best equipment I have for extracting the tooth, okay? For extracting your tooth. How is that feeling now? Do you think it feels numb? Do you want to open your mouth wide for me, please? Okay, I'm just going to flick your gums, okay? Did you feel that? Let me just try one more time. How was that? You felt that? A little bit? Okay, that's not too bad. At least it's taken some effect, because that would be really painful. Okay, usually, but obviously it's numbed it down somewhat. Okay, so it's time to extract your tooth. Open your mouth nice and wide for me, please. Okay, open it nice Nice and white. Okay, nice and white. Let me just try and extract that tooth. Okay, here we go. Keep calm, keep calm. No need to panic. No need to panic. Okay, it's going to be going in there. Going to be going in there. Okay, okay. I've got grip on the tooth. Okay, are you ready? 3, 2, 1. I got it. I got your tooth, look. There it is, look. You can see your tooth. Can you see that? That's pretty crazy, isn't it? You got your tooth there. Goodness me. Goodness me. That wasn't so bad, was it? That wasn't so bad there. So can you see how rotten it is? At the base of the root. Absolutely disgusting. Look, you're a creature. You're an absolute creature, aren't you? Actually, doesn't look so bad, really. Now that I've pulled it out, it almost looks normal, in fact. That's interesting. Okay, that's no problem. No, that's no problem because it was cleanly extracted. Let me just very quickly get you a cotton bud. Okay, I don't have any cotton buds, but I do have this little rag. This little rag here. Okay, so just stick that in your mouth. Okay, stick that in your mouth there and just bite down on it. Just bite down on it. Okay, and that's going to absorb all the blood that's coming out right now. Okay, and it is going to bleed for quite a while. It's going to bleed quite a lot. So I would recommend keeping that rag in your mouth for as long as possible. Okay, just take it out every now and then. Check it. You know, and once the bleeding has stopped, then you can take it out. Okay, so well, that's the end of our dental appointment today. Congratulations. Now the matter of payment, that was just let's call it $50 please. $50. Oh, nice one. Thank you very much. Was that a tip? A tip? 100. 100. Well, that's really nice. I appreciate that. I appreciate that a lot. Thank you so much. I'll just add it to my pile. There you go. Add it to the pile there. Well, that's very nice of you. Thank you so much for giving me a tip. That's really. I appreciate that. I appreciate that a lot. You know, you're welcome back. You are welcome back anytime, sir. Anytime. You are welcome back. Okay. Now, right, I think that's everything. I think you're ready to go back home now. You've had your tooth successfully extracted. Okay, that's going to stop bleeding soon. Obviously, afterwards, you don't want to eat any solid food for a while. No hard food. Try soups. Try, jelly. Jelly's really good. Jello, you might call it. I call it jelly because I'm from the UK. Okay, that's what it's actually called, jelly. Okay, maybe you can have a couple of smoothies, juice, something like that. Maybe drink through a straw as we talked about earlier. But yes, and just try and maintain good dental hygiene. Okay, because prevention is better than cure, and that applies to almost everything, including your oral health. We don't want to have to extract any more of your teeth, do we? No, we don't. No, we do not. Okay, there we go then. Thank you so much for coming. Thank you for giving me a tip. I really appreciate that. And maybe I'll see you again in the future for anything else. I'm pretty multi-talented. I can do almost anything, really. Okay, very good. Nice to meet you. Take care. Goodbye. Goodbye. What's up, player? I am the Hood Doctor. Very good to see you. I believe I've seen you before, haven't I? Yes, I think we did a dentist appointment together, didn't we? Hell yeah, I remember. You tipped me. You tipped me. You are always welcome back. Always welcome back. So, how can I help you today? You bumped your head. How did you bump your head? You don't need to go into specifics, but just give me a rough idea. You were trapping on the block and someone hit you over the head. Someone hit you on the head. What the heck? Why would that happen? You were trapping on someone else's block. I see. I see. Pushing into turf you shouldn't have been in. That's very naughty indeed. I think you're lucky, actually, that you only got hit over the head. Well, that's okay. You've come to the right place. The hood doctor can make sure that you don't have any brain damage, okay? And that's what we want, okay? We gotta keep all our brain cells, all 2 of them, okay? So, let's begin. Today actually calls for a cranial nerve exam to make sure that your brain hasn't sustained damage, okay? So, the first thing I need to do, I need to put on some gloves, okay? Let's keep this sanitary. Let's be professional, shall we? One moment. Okay, just put these on. 1 second. Rip the glove a little bit there, but I'm not going to replace it. Okay, it's good enough. And I'm not made of money. I haven't got a million gloves lying around, okay? Okay, I'm nice and gloved up now. Now, the first thing we need to do is we need to test your sense of smell. Can you still smell things? Okay, luckily for you, I've got 3 bottles of different smells for you to sniff. Okay, so let's do that. Okay, this is quite self-explanatory. I think you will agree. What I'm going to do is I'm going to give you this to have a little sniff of. Sniff, 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 sniff. Okay, and what do you think that smells like? Garlic. Yes, very good. Well done. Okay, off to a good start. Let's do all 3 though to make sure that your sense of smell is still working. Okay. Scent number 2. Okay, scent number 2. If you could smell that for me, please. Okay, very good. And what do you think that one smells like? Cheddar cheese. Excellent, excellent. Right, and let's go for the 3rd and the final scent, shall we? 3rd and the final scent. Okay, now, what does that smell like? It smells like Mary Jane. Correct, excellent. You did very well there, very well indeed. Okay, before we go any further, I do need to write down your results as we go along, okay, so I don't forget. Otherwise, this whole thing is pointless, isn't it? Right. So, I'm just going to get a pen. And I'm just going to write down the results of your smell test, okay? Okay, I'm just going to take a few notes like that as we go through today's cranial nerve exam together. Okay, now the next thing we need to test is your sense of taste. Okay, very similar to the smell test. I've got 3 bottles of different flavors for you to taste. Okay, so let's do that now. Right, exactly the same as last time, except this time you're going to be tasting instead of smelling. Okay, so put your tongue out for me. Very good, there we go. Put a little droplet on there, little droplet. Okay, and now, can you tell me please, what does that taste like? Yes? Orange, very good. Okay, now, let's do all 3. Okay, let's be professional here. I might be the hood doctor, but I'm a professional hood doctor, okay? Professional. that taste like? Coconut, that's correct. It tastes like coconut. 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 Very good. Good job. Okay, let's do the final taste. Okay, let's see. Right, prepare your tongue. Very good. Do a little droplet, 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 droplet. And what does that taste like? It tastes like the bitter taste of defeat. Correct, correct. Well done. Okay, so it looks like a couple more notes. It looks like you can smell and you can taste. So we're off to a very good start. Excellent there, excellent. Right, now what do we need to do next? What do we need to do next? I think we should start to examine your eyesight. Let's see if you can still see. Okay, now I do believe I have an eye chart that we can go through together. Very professional. Let's go. I like the sound. Nice, isn't it? Okay, now then, stay where you are. Don't come closer. Don't come closer, mate, because you'll be cheating. And also don't go further away, because the results will not be reliable then. Okay, let's be professional. Now then, I'm going to point to letters. You're going to tell me what the letter is. Okay, quite simple, quite simple. Now then, what is this? Good. 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 Okay, good. A bit difficult this one, is it? This whole line, a bit difficult. What about this letter? Okay, okay. And can you tell me, what is this colour here? Red. What about this colour? Green. Okay, good. You aren't colourblind and you can see somewhat. Now, can you cover one eye for me, please? I'll just do a few random letters, not the whole chart. That's boring, isn't it? Okay, a few random letters. Now, what's that letter? Good. 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 And can you see this? Okay, now cover the other eye for me, please, and we shall do a few more random letters. A few more random letters. Good. 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 Okay, okay, you can uncover your eyes now. You can see. Okay, that's very good actually. That's very good indeed. Let me just write that down. Write that down, okay. Patient can see. Okay, very good. Important note there. Important note. Right. What am I going to do next? I do believe I need to actually look at your eyes, but with a light. Okay, I need to look at your pupils, how they respond and change to things, and I need to look at the whites of your eyes as well. Very important. Very important. Okay, so what I would like you to do, please, is I would like you to look at my nose, or I suppose where my nose would be if I wasn't wearing a balaclava. Okay, and just you have to deal with on a day-to-day basis. Very good job. Keep just staring at my nose. Okay, and I'm just having a little bit of a look in your eyes. Interesting, that's quite interesting. Let me just check the other eye as well. Okay, that is interesting indeed. One moment, whilst I think. One moment. Let me use my little brain for a second. Okay, right. Let me just look a bit more closely at your individual eyes. So now I'm going to cover your eyes with my hand. Okay, just the one eye at the time. Okay, so there we go. Cover the one eye there. And now I just want to very quickly observe what happens when I do a little bit of this. A little bit of shining the light in one eye at a time, you know. Yes, very interesting response. Very interesting response. Let's do the other eye, shall we? Let me just cover up your eye there. Half the eye. One eye, yes. Yes, that's half of two. Let's have a little look, shall we? Oh, interesting. Interesting response. Your pupils getting quite large, quite small, quite large, quite small. You haven't been smoking anything, have you? You're not on drugs right now, are you? Okay, good, because that would affect your pupils. I should have asked that before. Okay, but good, no drugs, not today. Okay, well that's good then, that's good. Let's see now, right, what do I want to do with you next? Okay, I think I want to see if you are experiencing double vision. Okay, so what I need you to do, focus your eyes on my finger, this one here, okay, wiggle, 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 wiggle. Okay, now it's going to move closer to you. Keep focusing on it. Keep focusing on it. Okay, are you focused on it? Very good. And now we're going to move further away. Now, how many fingers do you see? Just the one finger. That is correct. That's good. That's how it should be. What about now though, when it's really close? Can you still only see one finger? Yes, okay, excellent. Excellent. That's a good sign. That's a good sign. Okay, no double vision for you. Very good. Very good. That's what we like. That's what we like. Okay, going back to utilizing my light. This time I want you to keep your head still for me. Imagine that you're a statue, okay? You're a statue. Perfectly still statue. And I'm gonna shine the light and you're going to follow it with just your eyes, okay? So just only moving your eyes, not your actual head. Understand? Yeah, just like that. Very good. Perfect. Okay, so follow the light for me. Follow the light with your eyes. Very good. Very good. Are you experiencing any pain or discomfort there? Pain or discomfort whilst following the light? No pain or discomfort. Okay, very good. Very good. Excellent job there. Excellent job indeed. Excellent job indeed. Apologies for the noise in the background. I think this neighbourhood is a bit bad, a bit rough, full of criminals very well so far. So far, I think no brain damage. No brain damage, okay? But who knows? We've still got quite a few little tests to do to check. Okay, now the next thing I would like to do is I would like you actually to look up for me. Okay, just look up for me. Very good. Now, what I'm going to do is I'm going to test your little reflexes of your eyes. Don't worry, I'm not going to actually touch your eyeball, but I am going to touch just around the eye, just here. Okay, interesting. I need to do that again with the other eye. Okay, continue to look up for me, please. Continue to look up. And don't worry about the pen. Don't worry about the pen as it approaches your eye. Okay, good. I'm just looking for the reflexive response there, and I saw it on both eyes. So that's excellent. That is excellent. Okay, what was the next thing I wanted to do with you? That's right. I want you to close your eyes for me, please. Close your eyes. No cheating, no peeping, okay? Otherwise, I'll give you a slap, okay? I'll give you a slap if you cheat. This is important medical test. Now, keeping your eyes closed, I want you to tell me when you can feel something. I'm going to poke you on the face with the pen, random locations, okay? Here we go. Good. 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 Okay, now I'm going to be doing something slightly different. I'm going to poke you with either the point of the pen, which should feel a little bit sharp, or I'm going to poke you with the butt of the pen, okay? And that should feel blunt or soft. Okay, so if you could tell me sharp or soft, depending on which side you feel, okay? Keep your eyes closed. Keep your eyes closed. Here we go. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Excellent job there. Excellent job. Okay, you did very well there. You did very well there. Actually, let me just write that down as well. Okay, on my clipboard. Okay. Did very well there. Important note. Important. Okay. Now then, let me see. What else? What else do I need to do with you? Okay. Yes, I do believe it is time to test your peripheral vision. Okay. So I need to focus on my nose, or this little area here. Okay. Keep your head still. Focus on the nose. Now I'm gonna move my fingers. Okay. And I want you to tell me when you can no longer see my fingers. Okay. Good. Now let's keep going. Let's keep doing that. Good. 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 Let's do it a little closer, shall we? Good. 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 And let's do it further back as well, shall we? Further back. Good. 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 Very it's a bit silly, it's a bit strange, okay? It might seem like I'm taking the piss, but I'm not, okay? This is it. This is actually important, medically speaking, okay? So, first thing I need you to do is I need you to puff out your cheeks for me as much as you can. Good, and now I need you to suck in your cheeks as much as you can. Good, now a giant grin, if possible. Very good. Now I want you to frown as if you're angry and you hate me. Okay, good. Now raise your left eyebrow. Now raise your right eyebrow. Okay, a bit difficult there. Okay, that's no problem. Now close both your eyes, shut them as tight as you can, please, as tight as you can. Good. Now wink at me with your left eye, okay? Good. Now wink at me with your right eye. Good. Okay, now what else is there? Let me just think. Okay, yes. Can you open your mouth as wide as you can for me, please? Okay, good. Now stick your tongue out. Raise your tongue up for me, please. Good. Lower your tongue for me, please. Good. Tongue to the side for me, please. Good. Tongue to the other side for me, please. Good. Can you touch your nose with your tongue? Okay, not quite. That's okay. Okay. Put the tongue back in now. Very good. I think that's everything there. Now, I do want to look in your mouth a little bit further. So let me just grab a stick to put in there. Okay, 1 second. Okay, got a little bit of a lollipop stick here, and I'm going to stick this in your mouth. Press down your tongue with it, and I'm just going to look in your mouth. Okay, so open up your mouth for me, please. Very good. Let me just put that there. Excellent. And let's just have a little bit of a look, shall we? Have a look in that mouth of yours. Have a look in that mouth of yours there. Interesting. Okay, interesting. Good coloration. Not excessively red. Got a little bit of an ulcer there, haven't you? A little bit of an ulcer. That's no problem. Just going to put that back in. Sorry. One ulcer, not necessarily a sign of anything terribly wrong. Okay. We all get ulcers from time to time. Could be stress, could be a bad reaction to spicy food. It's not necessarily anything terrible, okay? Okay, that's not bad actually. Not bad, your mouth is looking okay there. Now, what else did I want to do? Just very quickly, please, I want you to swallow for me. Do a big gulp. Good, okay, yeah, I'm just checking that everything is moving correctly as it should be, that you're just able to do things. Okay, basic things. Now I need to check the strength of some of your movements, your nerves, your control over them. Okay, so the first thing I need you to do, I need you to shrug your shoulders. Okay, just do that a few times for me. Very good. Now I'm going to place my hand against your head. You're going to push against it. I'm going to be trying to resist you with some force here. Okay, go on, push. Good. Now the other side as well. Push that side. Good. Okay, now push backwards up against my hand there. Good. Now under your chin, push downwards for me. Push downwards. Very good. Now hold your arms out straight for me, please. Hold your arms out straight for me. I'm going to just hold on to the tops. Push up against my hands. Push. Good. Now push down against my hands. Down. Okay, good. Now try and push outwards against my hands. Okay, push. Okay, good. And now push inwards. Try and squeeze my hands together. Squeeze them together. Okay, good. That's good. You have good strength there. Good strength. Okay, let me just write that down actually before I forget. Okay, excellent. You're doing very well. I think we've gone through the majority of the test. We do have to look at your hearing ability though. What little tests do I want to do for that? Okay, I think first things first, close your eyes for me. Close your eyes, no cheating once again, okay, because I will hit you, okay, I will hit you. I'm not afraid to hit you. Do I look like I work for a proper medical institution? Do you think my boss is going to fire me if I hit the patient? No, no, okay, this is the hood doctor. This is the hood doctor. Okay, keep your eyes closed. Keep your eyes closed. Now, which side of your head is this sound coming from? Was that left or right? Good. Let's try that again. Left or right? Good. 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 Okay, excellent job. Let me see. What was the next one? Keep your eyes closed. Keep your eyes closed. Did I say you could open your eyes? No. Okay, keep them closed. Now, I'm going to make a sound. I'm going to move the sound further and further away from you. And I need you to tell me, please. I need you to tell me when you can no longer hear it, okay? Here we go. Tell me when you can no longer hear this sound. Okay, good. Now we're going to do the one ear. Good. Okay, now the other ear. Good. Okay, excellent job, I do believe. Keep your eyes closed. Keep them closed. I need to use a little tool to make a little sound. I'm going to make two sounds, and you're going to tell me which sound is closer to your head, one or two. Okay, so keep your eyes closed. Here we go. Which sound was closer to you, one or two? Two. Good. Good. One or two. 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 Good. Very good. Well done there. Okay, now the final thing I need you to do, I guess you can open your eyes for this, that's okay. I need you to repeat back to me some words that I'm going to whisper into your ear, okay? Now then, let's do a little whisper, shall we? A little whisper. Now then. Gang violence. What did I just say then? What did I just say then? Gang violence. Right, correct. Very good. Menace. What did I just say then? That might be a difficult one for you. Menace. Yes, good, good, good. Incarceration. What did I just say then? What did I just say then? Incarceration. Correct, correct. Asbo. What did I just say then? What did I just say then? Asbo. Correct. Okay, that's enough. Okay, I believe everything is good. Let me just consult my notes. Let me just double check, because maybe I forgot that you performed badly at something, but I don't think so. Okay, let's see here. That's perfect. That's also good. consulting my notes, I think I can safely say that you have no brain damage. That's a win. That's a win. Take that as a win, my brother. Okay, because, you know, we live in a crazy world. Crazy stuff happens, and we need to look after our little brain cells as best we can. Very easy to just destroy all our brain cells. You know, I'd be drinking, I'd be taking drugs, I'd be getting hit in the head all the time. I'd be losing brain cells left, right and centre. It's a wonder that we're still even capable of communicating and doing basic things, you know. Dangerous life that we lead. But your health is perfect. After my cranial nerve exam today, perfect health, well done, well done. Okay, so if you could just give me the little bit of the monies that you owe. Last time you gave me 100, maybe you could give me 100 again. 100 again, okay, very good, thank you so much, I take that there. Right, well, if you're happy, I'm happy. You have any questions for me? No questions? Okay, that's excellent. There we go then. That concludes our hood doctor appointment today, and perhaps I'll see you again in the future. Remember, you can always come back to me. You can rely on me. You know what I'm saying? I do that good stuff, baby. I do that good stuff. Okay, so maybe I'll see you again in the future. Take care and good luck trapping on the block. Bye. What's up, Playboy? My name is the Hood Doctor. Very good to see you today. How can I help you? How can I help you today? You got problems with your ears, ringing in the ears, is it? How long has this been happening? It's been happening since you were chased by the police the other day. You were chased by the police. Maybe the sirens of the cars have impacted your hearing a little bit. Do you think that's possible? Yes, I think that might be the cause, but we will double check today, okay? I'm going to take a look at those ears and we're going to solve the problem. Okay, let me just get some gloves on and then I will have a little hands-on inspection and look in your ears. Okay, I'll be back in just a second. Okay, let's get my little gloves on now. Get my little gloves on. Keep everything nice and clean. So I think the first thing we need to do is I need to actually take a look inside those ears with my light. I think that's the first thing to do. Okay, so let me just have a little look here. Let me just have a little look here in the ear. Look here in the ear. You know what I'm saying? Look here in the ear. Look here in the ear. Interesting. No signs of physical damage on the outer areas of the ear. Okay, let me just check the other ear as well, of course. Let me just check the other ear. Okay, check the other ear. Somebody check the other ear. Okay, this ear looks very much the same as the other ear. Okay, very much the same as the other ear. No immediately obvious signs of physical damage. Okay, no obvious immediate inside your ears, right into the ear canal. Not too deep though, not too deep, nothing to be concerned about. And then I'm going to look through it and I'm going to see the inner workings of your ears, okay? So let's have a little look at those bad boys, shall we? Let's have a little bit of a look at those bad boys. Oh, I see. Interesting, very interesting indeed. Very interesting indeed. Interesting. You have a lot of earwax in here, an unusual amount, I would say. Have you been collecting it? Collecting earwax? That's a strange hobby. That's a strange hobby to have, collecting earwax. Stamps, I've heard of that, but not earwax. Okay, let me just check the other ear as well, okay? We'll have a little look at this side of the ear canal as well, this side as well. A little look at the ear canal. I see. Very much the same situation going on in that ear as well. Very much the same situation. A lot of earwax. Too much, frankly. Okay, so I think what I'm going to do to you today is I'm going to do a bit of an ear clean, just a very quick one, and then I'm going to perform a hearing test on you to make sure that you can hear correctly. In my opinion, the ringing in your ears, the ringing that you are experiencing, will be a temporary side effect of being exposed to those loud police sirens. That should pass, okay? But let me just do a clean and a hearing test as well, just to make sure that everything's okay. Alright, so the first thing I want to do is I want to put some special liquid in those ears of yours, and this liquid is going to activate, and it's going to dissolve the earwax, not entirely, but it's going to dissolve it enough to the point where I can just go in there and scoop it up, you know what I'm saying? Scoop it up, you know, okay, so let me get that solution. Where did I put that? Okay, here it is, the magical solution, magical solution. Would you like to tilt your head to the side for me, please? Very good. I'm just going to put a couple of little droplets in the ear. Okay, now you can probably hear it and feel it working. It's going to feel somewhat like Rice Krispies when you add milk to it. It's going to be a little bit of a snap, crackle, pop. Okay. Now you can tilt the head to the other side for me now, please. Right, let's get that other ear solutioned up, shall we? Solutioned up. Righto, let me get a little bit of droplets in there. Little bit of droplets. And now you should be experiencing the snap, crackle, pop effect in the other ear as well. Okay, so stay like that for just a minute. And now I think I need to get my cotton buds. Okay, so 1 second. Right, it's time for me to clean out those ears of yours, okay? Using a simple cotton bud. Pretty simple, just like me, really. Right, let me just go in those ears. We'll begin with this one, shall we? Here we go. How does that feel? Not too intense, not too crazy. No? Okay, good. I'm gonna keep going just a little bit more. Okay? So then, if you're ready, I think we're going to do a little hearing test, okay? And to do this hearing test, I'm going to... Oh goodness me, I dropped what I was going to use. One second. Okay, we're going to use some headphones. Unfortunately, they aren't Dr. Dre beats. Nothing particularly cool, okay? Nothing particularly cool. Just some generic little headphones here. Generic little headphones. Okay, but they shall suffice. Pretty good sound quality, actually. They've got these lovely little pads. Oh, they feel so soft. So soft on the ears. It's like wearing some clouds on your head. Quite lovely. Okay, so I'm going to put these on your head now. Okay, very good. And I'm going to hook those up to my little microphone here and to my little computer here, my little laptop. Okay, quite an advanced setup we've got here. Quite high tech for the hood. I think you'll agree, high tech for the hood. Okay, now what I'm going to do is I'm going to play a little backing track for you to listen to whilst we do a few different experiments. This is going to make it block out all the background noise, and it's going to be an essential part of the hearing test itself. So one moment whilst I put on that backing track. Wait a minute, did I put on the correct one there? What is that you're listening to right now? Let me just oh, that's the wrong track, isn't it? That's the wrong track. Oh yeah, there's someone I was listening to earlier. Okay, my apologies for that. Let me put on the correct backing track, okay? Just put those on there. Is that comfortable? Excellent. Okay, let me put on the correct one. There we go. That should be much more relaxing. Is that much more relaxing? Very good. Okay, so we got the right one on now. The first thing I need to do with you is something known professionally as the beep test. The beep test, okay? I'm going to play through the headphones a series of different beeps, and they're going to be different volumes, different frequencies, and different patterns. And your job is to tell me whether or not you can hear them. Okay, so whenever you hear a beep or a series of beeps, you just tell me yes. Okay, so let's do the first one. Could you hear that? Very good. Let's do the next one. Could you hear that? Excellent start, excellent start. Let's go for another one. Could you hear that? Very good. Couple more beeps, Could you hear that? Very good. And could you hear that? Very good. Okay, so you've passed the beep test. You can hear different frequencies and different patterns. Okay, very good start to the hearing test. Very good start. Now then, I'm going to produce various different sounds around your head utilizing this microphone that is hooked up to your headphones. Okay, I want you to close your eyes throughout the entirety now of the hearing test. Okay, so no cheating. No cheating. I will know if you cheat, and I will give you a smack. Okay, give you a smack. Don't make me do that. I don't want to smack you, but I will if you open your eyes. Okay, so keep your eyes closed throughout the entirety of this hearing test. Now, okay, now I want you to tell me what side of your head this sound is. Okay. What side was that, left or right? towards the left or right portion of the hearing test. Now the next thing I'm going to do is I'm going to produce a number of clicking sounds. Okay, number of clicking sounds. And I want you to tell me the total number of clicks that you hear, regardless of their position. Okay, does that make sense? Yes. Now let me grab my clicking device. Listen closely. How many clicks was that total? Good. And how many clicks was that total? Good. How many was that? 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 Very good. That last one a little bit difficult, required quite a bit of concentration. I think. Okay, excellent job so far. Excellent job so far. Now, I want you to tell me, please, when you can no longer hear this sound. Good. Now, individual ears. Good. Good. Excellent job. Excellent job. Let me see now. Next, I want you to tell me which of the two sounds is further away from you. Okay, I'm going to be producing two different sounds. Which one is closer? Which one is further away? Okay. Which one was closer? One or two? Good. 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 Okay. Actually, I think that's the entirety of the hearing test. So, let me take those headphones off you for just a minute. There we go. Well, I must say, I'm sorry, I like that sound. Okay, enough faffing about. I must say, you performed perfectly well during today's hearing test, and obviously I did that little ear clean as well at the start of our time together today, and I think your ears are now tip-top condition, nice and clean, no disgusting earwax in there. Okay, your hearing is clearly very good because you did everything really well during the hearing test. as I said, I think that is just an unfortunate temporary side effect of being chased by the police. You know, they're very loud, the police, very disrespectful, no manners, the pigs. You know what I say? F the pigs, yes, F the pigs. Okay, I don't need to tell you that though, you know that. So then, if you could just pay me now, that will be $100, please, $100, just like the last time. Very good, thank you so much. You're always so polite and you pay me just the right amount, and I must say you're an excellent individual. It's quite rare that I deal with such well-mannered people. Usually I'm dealing with psychos, psychotic people, and crackheads and all manner of strange individuals, but you're okay. So thank you for coming and using the hood, Doctor. Once again, I do appreciate it, keeping me in business, and perhaps I'll see you again for something else in the future. Okay? Take care, and good luck out there in that crazy, crazy world. Goodbye. What's up, Playboy? It's me, the Hood Doctor. Once again, good to see you. What's happened to you today then? You've got something in your eye. Struggling to see, is it? And a little bit uncomfortable, I imagine. Okay, that's no problem. Let me put some gloves on, get a light, and I'm gonna see if I can actually see physically what's inside your eye, what's irritating you. Okay, 1 second. Okay then, I'll just get my gloves on, just to make sure I don't put anything else in your eyes from my fingers, you know what I mean? That would be very counterproductive, wouldn't it? Make things worse. I don't do that. Special little light, and let's have a little look, shall we? Do you know which eye it's in? Let me just lift the eyelid there. Let me have a little look. Both your eyes are hurting. That's unfortunate, isn't it? Looks like you've got something in both your eyes then, is it? Maybe, let's have a little look and see. Can't really see anything obvious. Perhaps it's something very small. Could be dust. I know that sounds a bit stupid, but it could be dust. Could be just a little bit of dust irritating your eye. Have you been working in any sort of high dust environment? Oh, look at that. Can you hear that? They've started playing music in their cars. Absolute menace to the neighborhood, a menace to the block, giving us a bad name. That's okay though, that's okay. I can't really see anything with just a light. Let me get a magnifying glass, maybe that will help me. Let's have a little look then again, shall we? Maybe the magnifying glass combined with the light. Is it? Let's see, does that help me? Is that helping me? I don't think it is it? Oh, I don't think so. Let me just have a little look here. It doesn't seem to be helping me. I can't see anything there. Perhaps the other eye will be clearer. Let me just check with the magnifying glass once again. Maybe here, maybe over here. Peculiar, difficult to see a little bit. What is this that I see? A little bit of some sort of powder residue, white powder residue in your eye. What is that? Have you been mixing cocaine or some sort of drug, white powder drug? I think you may have some in your eyes. That's not good. You can absorb things through your eyes. You know that, don't you? Yes, I mean it's going to enter your bloodstream. You're probably going to be feeling the effects of whatever that suspicious white powder is. Okay, so let's get that out of your eye, shall we? Post haste. Okay, what do I need to do that? I think first things first, let's get some solution in your eyes. It should get rid of some of the pain and hopefully dilute that powder so that its effects won't be so noticeable. Okay, let me get the solution. Mixing up the solution. Right, that's enough mixing. I'm going to put a little bit of droplets in your eyes. Okay, eye drops. The solution. Okay, open your eyes nice and wide. Don't blink. Okay, that's one eye done. Very good. That's the other eye done. You can blink now if you want a couple of times. Excellent. Now, it is time for me to utilize the simple cotton bud. And I'm going to physically clean your eyeballs. Okay, your eyeballs. We'll do one at a time. And I'm going to hold them open with my fingers. And I'm going to get right on there with the cotton bud. It should not be painful and it should not be too uncomfortable because of the solution. Okay, it's going to lubricate your eyeballs. Lubricate your eyeballs. Okay, now let's start with this one here, shall we? Start with this one here. Let's have a little bit of a look here. See if I can't clean that eyeball of yours. Clean the eyeball. Get some of that suspicious white powder residue out. Okay. Just going to be giving it a really good clean on the eyeball there. Absolutely wonderful set of eyeballs you have here. Wonderful set of eyeballs. Okay, that's pretty good. Let's do the other eye now. Okay, how's that? How is that? Let me just try and get that a bit better. There we go, I think that's perfect, isn't it? That is it. That's the one. That is the one, baby. I'm in. Absolutely cleaning this eyeball like there's no tomorrow. Marvellous job here. Marvellous job. Lots and lots of gunk coming off your eyeballs. Didn't realise how dirty your balls were. Your eyeballs. Very dirty little eyeballs here. Don't you wash them? You don't wash your balls regularly. Your eyeballs. Well, that's a bit questionable. I think questionable is the correct word for that. Questionable. That's good. I think we've got a lot of dirt and debris out of your eyes there, so that should be much better for you already. Let me just double check. Let me get my light again. only your eyes. Follow the light as it moves around. Okay, and I want you to think carefully whether or not you feel any pain or discomfort whilst your eyes are moving in these unusual shapes, and whether or not you're having any difficulty in general looking at the light. Okay, maybe some sensitivity. Okay, how do you feel? How do you feel following the light? How do you feel? You feel okay? You feel good? Excellent, excellent, excellent indeed. That is excellent. That is excellent. That is excellent. Oh, let's just do a full check of your eyes whilst we're here. An eye test, you might call it. I've got an eye chart. I think I've got an eye chart. Let's do an eye test. Right, okay, so don't come any closer to me and don't move further away. I am positioning this perfectly. There it is, the perfect position. Absolutely perfect. That's bloody perfect. Bloody perfect. Oh, goodness me. Right, now I'm going to point at letters. You're going to tell me whether or not you can see the letter. Tell me what the letter is. Okay, you've done one of these before. Very simple, very simple. Okay. Good. 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 It's a bit small, this, isn't it? A bit difficult. Okay, okay. What about this? What colour is that? Okay. What colour's that? Okay, good. What I want you to do, I want you to cover one of your eyes, please. Cover one of your eyes. I'm going to point to just a few random letters. What's that? Good. 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 Okay. And now if you could cover the other eye for me, please. Cover the other eye. Cover the other eye. Cover the other eye. Good. 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 Okay, that's pretty good. Good vision there. You can uncover your eye. Of course. Of course. Of course. Of course. Now then, I'm going to hold up a couple of different lenses. Okay, between you and the letter E. And I want you to tell me, please, which lens is clearer, lens 1 or lens 2. Okay, so the letter E, 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 there, the letter E. Now, lens 1 or lens 2, which is clearer? Good. Now, lens 1 or lens 2, which is clearer? Good. Lens 1 or lens 2, which is clearer? Good. Lens 1 is his brother? His brother has come to say hello. What color is his brother? Usually I don't ask a brother's color. That's a bit rude, isn't it? But in this instance, what color is this brother? He's orange. Orange brother. An orange brother. Okay. Now then we have here another one. Another one. This guy looks strange. Oh, he's like deflated somewhat. Deflated. Looks a bit strange on the back there. Something strange has happened to this guy, isn't it? This guy's been through some shit. Look at that. Poor fellow. Poor fellow. What colour is this dude though? What colour is he? A bit sad actually, isn't he? It's a bit sad. He's pink. Poor little guy. Let's not put him through any more than necessary. Let's be gentle. Let's be kind, shall we? Okay. Now then, what about this? What about this? What colour is this dinosaur? A Dinosaurus? A Dinosaurus Rex? What is the colour of the dinosaur? Oh my goodness me! This dinosaur's arm is broken. Get this guy to a doctor immediately. Get this guy to a doctor immediately. Poor dinosaur. Poor dinosaur. He is yellow though. He's yellow. Okay, yellow. Correct. Poor dinosaur. All my little friends. They're all broken. Just like me. Okay. Let's have a little look at my next friend. My next friend. What color is this? What color is this? What color is this little dinosaur? Oh, he's a blue dinosaur, isn't he? He's a blue dinosaur. Oh, very nice. Bit of interesting coloration on his little nodules there, on his lumpy bumpies. Lumpy bumpies are a little bit purple for some reason. Interesting, interesting. Okay, okay. Shall we do one more? One more little friend. One more little friend. One more little friend. We shall have this friend here. What color is this little friend here? Hello. He's coming to say hello to you. Hello. Hello, little person. Hello. How are you? Hello. Orange. Correct. He's an orange friend of ours. Orange friend. As you can see, my friendship group is very diverse in color. Okay, so I will have no accusations from you or anybody else that I am not friends of all kinds of people. Okay, friends of all kinds of people, all colors, all species. It doesn't matter to me. If you're a good person, you're a good person. It's quite simple. It's as simple as that. It really is. Okay, now then, I do believe. Oh, actually, I have one last test for you, if you're willing to do it, involving two different lights. Okay. Now then, as you can see, these two lights, they're different colors. Okay, we have a blue light and we have a yellow light. What I would like you to do, please, is I would like you to follow the yellow light only. They're both going to be moving, but I need you to follow just the yellow light with your eyes. Okay, and you do not want to get confused. Don't start following the blue light. Don't do that. Only follow the yellow light as it moves, okay? Don't get confused. Don't get confused. Keep following the yellow light. It's moving quite erratically, okay? And the blue light is very distracting. But do not get confused. Do not get confused, okay? Follow the yellow light. sparkling clean. And we've also done an eye test for you, which you have passed with flying colours. Flying colours. Well done. Well done, okay? Now, if you would like to give me a little, a little $100 to pay me for my time today, that would be very much appreciated. Very much appreciated. Oh, there we go. Excellent. Thank you so much. You're one of my favourites. One of my favourites, okay? I like you. I like you a lot. Now then, if you need anything else from the Hood Doctor, any more help required from the Hood Doctor, I am more than willing to help you, okay? So don't hesitate to come back and to see me again. You're always welcome. Always welcome. Thank you so much for coming in today, and perhaps I'll see you again in the future. Okay? Take care out there. Take care. Goodbye. Goodbye. What's poppin', Playboy? It's me, the Hood Doctor. Very good to see you. Very good to see you. What can I do for you today then? You've been experiencing dizziness. Dizziness. How long have you been feeling dizziness for? About a week now. Okay, okay. And is it periods of dizziness, or are you just dizzy constantly 24/7? It's more like periods of dizziness. Okay. Well, do you think, did something happen a week ago to cause these periods of dizziness? You got blackout drunk at the trap house and you fell over. You probably hit your head then, didn't you? Is that what happened? You hit your head. Okay. Well, you might have a mild concussion, which honestly you should have come to see me immediately. Okay, but now is better than never. Okay, I'll do a few tests with you today just to make sure that you're okay, right? So the first thing I need to do is I need to put some gloves on, and I'm going to physically feel around your head, okay, to see if I can feel any lumps or bumps, any abnormalities, anything like that. Okay, just get my gloves on now. Just get my little gloves on here. Pressing against your cranium, your head, basically forehead, around the eyes especially. Let me have a little press here. I want you to tell me if you feel any flare-up of pain. Okay, any sort of flare-up of pain when I'm pressing in these different locations. I'm only going to apply a little bit of pressure, nothing too crazy, okay? Nothing too crazy. But I do want to see if we can identify any specific locations, any specific trigger points for the pain, okay? Okay, so how is that feeling? How is that feeling? It's feeling okay, not too bad, okay? Interesting. That's a good start. Very good start. Okay, what I want to do is I want to use a stethoscope to listen to your vitals, is sounding fantastic. Fantastic. Hello, hello. You look a bit, you're having a dizzy spell. No, you're okay now. Okay, okay. Now I need to listen to your lungs, okay? As I was saying, your heartbeat. Superb, superb. What a great heartbeat. Okay, now I'm placing this on your chest. What I want you to do, I want you to take in a big deep breath for me, please. Hold it. Hold the breath. Hold the breath. Hold the breath. And then breathe out for me, please, slowly. Good, good. Okay, we're going to do that again. I'm going to do that again in one more location. Might do 3 locations total, okay? So now, breathe in for me. And breathe out for me. Very good, very good. And let us do this location as well, okay? Now, breathe in for me. Breathe out for me. Okay, okay. I have to say, I'm very pleased with what I've heard there. Your lungs, very good condition. Your heart, very good condition. Okay, so we can rule out any underlying problems like a cold, anything systematic, as the professionals say, systematic. Okay. Now, the first thing I want to do, I want to look at your eyes a little bit. Okay. Now, let me see. Let me grab a light. What I'd like you to do, please, is I'd like you to cover one of your eyes, and I have a light here, of course. I'm going to be bringing it into your field of vision, and I want you to tell me, please, when you can first see the light. So when it just about enters your field of vision, okay, from various different angles. So let's try that now. Good. 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 Okay, now I need you to cover the opposite eye, and we shall do it again. Okay, very important. Good. 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 Okay, that's excellent. That is excellent. Now, keep your eye covering that one eye. Keep your hand covering that one eye for me. And now I'm going to flash up some fingers. Okay, like this or like this. And I need you to tell me how many fingers I'm holding up. Okay. Now let's do that. 1, good. 2, good. 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 Okay, now cover the opposite eye. The opposite eye to what you were just covering, please. Okay, okay, good. Same test. Good. 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 Okay, very good. You can uncover your eyes now. That is very good, very interesting indeed. Now, I am just going to need to measure your eyes, particularly your pupils. Okay, your pupils. So let me find my little measuring device. This is a bit excessively long to measure some eyes, isn't it? I don't know anyone whose eyes are this big. Do you know anyone whose eyes are that big? No, I don't think so. That would be a medical anomaly, wouldn't it? A medical anomaly. Okay, good. Now then, I've got my little millimeters here. Let me have a little look. Let's measure those eyeballs, shall we? Let me just have a look there. Have a little look at the eyeballs. A little look at the eyeballs. How much do they measure? That's interesting. Let's see. How about the iris? The iris in comparison to the eye itself. The iris. Interesting. And what about the pupil? The pupil in comparison to the iris, in comparison to the eye. Very good ratios there. Let me do the other eye as well, of course. Okay, that is it. That's perfect alignment. Now then, how wide is this eye? Oh, look at that, it's almost identical. Almost identical to the other eye. That's excellent. Very good sign. Now the iris. Interesting iris size there. And the pupil. Once again, marvelous ratios there, marvelous measurements. Let me just write that down actually before I forget, okay? Let me find my pen and my clipboard. Okay, I'm just going to get a pen from my lovely little pencil case. Okay, let me write down the measurements of those eyes of yours. Almost perfectly symmetrical, which is really quite something. You could be an eye model, perhaps, an eyeball model. Get paid for showing off your balls, your eyeballs. Okay, good. So far so good. Okay, I do need to continue to look at your eyes with the light. So now I am going to cover one of your eyes, okay? I'm going to cover them just like that, and I'm going to bring in the light, and I'm going to move it out, okay, of your vision, and then I'm going to move it in to your vision, and I'm going to move it out of your vision, and I'm going to move it in to your vision, out, in, out, in, out, in, out, in. Okay, very good. I'm going to be doing the opposite eye, of course. Now, are you doing okay? Feeling a bit dizzy? Okay, I'll take it easy. With the tests. You let me know if you need a break, okay? Okay. Put the light in your vision here, and then out, in, out, in, out, in, out, in, out, in, out. Okay, I'm just looking there at your pupil. first thing I want you to do, you can sort of copy me, basically copy me. I want you to move your head to one of your shoulders like this, as much as you can, please. Okay, good. And now move it to the other side, as much as you can, very good. Back to neutral position. That was my glove, I promise you, that was my glove making a little fart sound. Okay, it wasn't me, I don't fart, okay, I do not. Right, now, back to the head. Tilt the head to the side like this, please. Tilt the head to the side and then bring the head back and then tilt it to this side as well. Continue to tilt the head to this side as well. Okay, excellent. Back to the neutral position, Tilt it back as if you are looking up to God and pleading for His mercy. Okay, very good. And now tilt it down, back to neutral. How did that feel? Did that set off an episode of dizziness, perhaps? Dizziness? No. That's good. That's a good sign. That's a very good sign indeed. Okay. Still, with the head, I want you to start to rotate your head, okay? As if it's a wheel. As if it is a wheel. Rotate your head, okay? Very good. Now stop. Rotate the head the other way. Rotate the head the other way. Rotate the head the other way. Stop. Go back to neutral. What about that? Did that induce an episode of dizziness? No. Okay. Good. Good sign so far. Good sign so far. Now, I want you to blink for me, please. Blink. Blink, blink, blink. Blink, blink, blink. Okay, very good. Now, I want you to look up for me, please, as far up as you can with your eyeballs. Now look down for me, please, down as far as you can with your eyeballs. What about that? Did that induce a feeling of dizziness? No. Okay, this is very good sign indeed. Okay, now let me just write down a couple of notes there. I think I need to write down notes as we go through today's exam together. Very good. Let us see. What do I need to do next to test you? What do I need to do next? Now then, I'm going to put my finger here. Okay, don't worry, it's not going anywhere else. I want you, please, to stare off once again into the distance, into the abyss, into the abyssal darkness. And now I want you to focus on my finger, the tip of my finger. Now I want you to focus on the abyssal darkness. Now the tip of my finger here. Now focus on the abyssal darkness over here. And now focus on the tip of my finger there. Okay, good. Did you feel any dizziness during that? No. Excellent. Let me just ask you a couple of questions actually before we continue with the test. Okay. Have you felt any pain during any of today's exam? Okay. Have you felt any headaches so far today? No headaches. Okay, good. No headaches, good. Any dizziness at all? Any dizzy spells during the exam today? One or two moments, I see. Yes, that was earlier, wasn't it? When you were doing the little tests with your vision. Yes, I noticed. Yes, I remember. Okay, very good. Interesting. Okay, have you been experiencing any ringing in the ears at all during today's test? good. What about this card? What color is this card? A green color. Excellent, excellent, excellent. What about this card? What about this card? Orange color. Very good. Very good. Very good. And what about this card? This card. Yellow. Yellow. Excellent. Excellent. Now then, I'm going to be utilizing some smaller cards. Some playing cards. I'm sure you're familiar with these. I'm sure you're familiar. Oh, one moment. Let me just get all the cards. A bit difficult when you're wearing gloves. A bit difficult. Give them a little bit of a shuffle. A bit unnecessary, I suppose, for this, but all the same, a little bit of a shuffle there. Can you tell me, please, what is the value of this card? What is the value of that card? Interesting, very good. Can you tell me, please, what is the value of this card? Of this card? Good, okay. Can you tell me, please, what is the value of this card here? What is the value of this card? Okay, good. Still just testing your eyesight, essentially. Okay, still just testing your eyesight. Now then, the next thing I want you to do, I want you to close your eyes for me, please. And I want you to tell me when something touches your face, okay? It could happen any moment, any location. You just felt something. Good, good. Okay, I'm going to do that a couple more times, different locations. Good, good, correct. Correct, good, 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 good. Correct, correct. One more time, one more time. Good, good. Okay, and now keeping your eyes closed, I want to differentiate between sharp and soft. Okay, so I'll use my finger like I did previously, and that will be considered soft. Okay, and I will also use the end of a pen. Okay, the end of a pen. It's sort of pointed, so that's going to feel much sharper in comparison. I want you to say, please, sharp or soft, whichever you feel. Okay. Sharp, good. Soft, good. Sharp, good. Sharp, good. Soft, good. Soft, good. Okay, so you can distinguish between different feelings, and you have sensation, the ability to feel all over your face. That is very good sign. Very good sign indeed. Now, the next thing I want to do with you is a little something called the smell test. Okay, open your eyes. I'm going to mix a few little solutions, and I'm going to get you to smell them for me, and you're going to tell me what they smell like. Okay, so let me prepare the solutions for you. Okay, prepare those nostrils. They're in for a treat. They're in for a treat, okay? Can you smell that for me, please? Can you smell that for me? prepared to smell once again. What do you think that smells like? Cinnamon. Cinnamon, yes, very distinct and strong smell, cinnamon. Now then, the third and the final smell for you to identify. Take a little whiff of that. A little whiffy whiff. Whiffy whiff, okay. What does that smell like? Freshly baked bread. Correct. Freshly baked bread. I love that smell. I love that smell. Hold on just a minute. Oh my goodness me, is that heaven? Is that heaven on earth? I think it might be. I think it might be. Okay. Now then, the next test is the taste test. I think you know what's going to happen next. Okay, if you could stick out your tongue for me, please. Very good. Now I'm going to put a little droplet of a flavor on there, and I would like you to identify what does it taste like. A gingerbread man. Yes, very good, very good. And interesting that you managed to tell that it was a gingerbread man and not a gingerbread woman. I think they must taste different. Well done, well done. Now the next one, the next flavor. Let's have a little taste of that, shall we? A droplet, a droplet, a droplet, a droplet, a droplet. What does that one taste like? Oregano. Oregano. Yes, very good. That was oregano. Excellent. The final one, the final one. Let's get the final one. Okay, right. The final flavor. If you're ready, here we go. What did that one taste like, the final flavor? Coconut. 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 Correct. That tasted like coconut. Very good. Very good indeed. Now then, let me write down the results of those tests, actually, just so I don't forget. 1 second. Getting a bit of a mess here on my little table. Write down the results. Good, good. So far, so good. Now then, what I would like you to tell me, please. How many fingers is that? 1. Good. Focus on the tip of my finger and continue to focus on it as it moves. It's going to come very close to you indeed. And then it's going to move very far away from you indeed, okay? Keep focusing on the tip of the finger though. Keep focusing. Keep focusing on the tip of the finger. Keep focusing costs. Long live the king. Long live the king. My life is forfeit before the king's. The king is all that matters, for the glory of the crown, for the glory of God. All hail the king. All hail the king. Excellent. Well done there. Well done there. Now, was the king in focus the entire time? Or did you struggle? Did you struggle? Certain locations, perhaps? He was in focus the whole time. Good. Very 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 good. Now, stay still. Don't look anywhere in particular. You can stare off into the abyss if you'd like. It matters not. It matters not. Now, I'm just doing a general observation of your eyes myself, okay? I'm using my eyes to look at your eyes. Realize, 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 you know what I'm saying? You know what I'm saying? Of course you do. You're an absolute G. You're an absolute G, just like myself. Real ones know, real ones know, okay? I don't need to explain that to you, of course. You absolute real one. You absolute real one. Sorry. Keep scratching my chin a little bit. Very itchy in this balaclava. Very itchy. Itchy, itchy, itchy. I'm just checking your eyes, okay? Don't mind me. Don't mind me. Okay. 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 And during that you didn't feel dizzy at all, did you? No. No. Okay. Let me just consult my notes. Let me just consult my notes very quickly. Very quickly. Don't need that. I don't need my pen. Yes, I see. I see. Very good. Very good indeed. Very good indeed. Interesting. Interesting. Yes. Yes. Okay. Excellent. Excellent. Okay. I have some good news for you. I have some good news for you. I believe that you are in tip-top health. I think that when you were drunk last week and you fell over and you hit your head, you may have suffered a minor concussion. Can you hear that child screaming, or is it just me? Is it just me? Maybe I'm going crazy. Maybe I'm here. I sure hope that child is okay. I sure hope so. Okay, but we're busy right now doing this, okay? We're busy. Now then, as I was saying, I think your health is okay. I think the dizziness you are experiencing is a temporary side effect of a mild concussion that you got from being too drunk and from falling over blackout drunk, okay? And I think it should pass on its own, and you should feel no lingering effects, no long-term negative impact to your health, okay? So I think you will be just fine, okay? But maybe try to look after your health a little bit more, okay? Go easy on the drinking, go easy on the drinking, okay? Now then, if you'd like to give me my payment, a little $100 like the previous times, that would be excellent. Marvelous. Thank you so much. Thank you so much. I do appreciate it. I appreciate you very much indeed. And remember, any more problems, do not shave my own hair, and underneath this balaclava is actually a beautiful mane of hair. Okay, have you ever watched Adventure Time? Very much like Finn. You know, he wears a little hood, a little hat with little ear thingies, and one episode he takes it off, and it is revealed that he has beautiful golden hair long. That's basically me. Okay, you want a haircut today? I can do a haircut for you. Okay, let me take off this lab coat. Feels a bit unnecessary for a haircut, don't you think? Okay, let me just get my stuff set up, and then we shall begin your haircut. Okay, got a little water bottle spray here. I'm going to spray your hair first, comb through it. Okay, and then you're going to tell me what kind of haircut you'd like. Okay, and I'm sure I can accommodate. I'm sure I can do it. Okay, here we go. Excellent. Nice wet hair now. Let me just comb through it for you. Got a few hooligans on the block today screaming, as usual, the little children. They simply can't do what they're told, can they? We tell them to trap on the block for a few hours. They can't do it. They get all upset and scream. They want to do children things like play games. Well, life isn't all about playing games, is it? No. We gotta make some money out here. And if we have to use a bit of child labor, why not? That's what I say. Those children, they can work just as hard as we can. Maybe not quite as hard, but you know, they should contribute to paying rent, in my opinion. Okay, now then, what kind of haircut would you like today? Classic sort of short back and sides, is it? How much length would you like to leave on the top? A few inches, that's good, and then I'll buzz the sides and the back for you. Does that sound good? Very good, excellent choice. And maybe I can also shave your face for you, if you'd like. You can make it nice and baby smooth once again. Yes, baby smooth. Okay, excellent. I believe we shall begin. The first thing I need to do, though, is I need to use some scissors to actually take off some of the length, okay? Because I can't go straight into buzzing that length of hair. That's an absolute mop that you've got there, okay? 1 second. Okay, let's begin. Snipping, shall we? A little bit of a snip. Snip. Sort of trance there, a trance-like state, a workflow you might call it, or maybe you might call it a borderline psychotic meltdown. I am prone to those. You know how many jobs I've been fired from because I've had mental breakdowns in them. Too many for me to remember, that's for sure. I've lost count of the number of managers and the number of customers that I've told to F off, to go and F themselves, to go and shove something where the sun doesn't shine. You know what I'm saying? Sorry, there's like one little hair that I can't quite get off, and it's annoying me. I can only imagine how much it must be annoying you. Come on, you little hair. Get off of there. You don't belong there. You foul little hair. Ah, there we go, it's gone now, Nice smooth face you have. Nice clean smooth face, that's perfect. Now then, I do believe we are ready to begin the buzz cut. What I'm going to do is I'm going to use 3 different cards today. 3 different lengths, okay? Okay, first of all, just going to take off everything that I want to take off from the sides, and then we're going to do a fade, okay? And for that I'm using 2 smaller cards. Just gently fade the sides into the top, okay? Right, let's begin. This might be loud, it's going to be quite close to your ears, okay? Get ready for it, here we go. Absolute perfection. Now we must change the card and get this fade underway, okay? Let's begin round 2. amazing. Okay, let me wipe down your face once again, get rid of all that irritating loose hair on there. I'll try and be a bit more gentle this time, okay? Because I know I was a little bit rough last time brushing the hair off your face, but it was necessary. It was a necessary evil. Necessary evil, okay? Necessary evil. Just get that hair off there. Get that hair off there. That hair off there. And also down here. Down here is a little bit of hair. A little bit of hair. Get that off there. I can imagine you're feeling a lot fresher already, a lot more free and a lot more clean. You've got less hair on the top of your head. You looked like an absolute mop when you came in before, an absolute mop, a straight up MOP on these streets. Okay, you know what I'm saying? Now then, that's good. I would like to, if you're okay with this, I would like to put some gel in your hair, special gel. Okay, give it a little bit of a styling, and it's also for hydration of the hair. Okay, it's going to stop it from becoming too dry and brittle. Important for the health of your hair. We must have healthy hair, and we must look good. How else are we going to get the babes? Okay, the babes. They're not going to get themselves, are they? No, we must take initiative. Okay, now let me get that little special hair gel. Oh hell yeah, we got this good stuff. You know this got that sandalwood. There's sandalwood in it. Okay. Let me just put some in my hands. Okay, let me just put some in my hands. Okay. Let me just get that rubbed in there. Okay. Right, and then of course, going to just put it in the hair there. Going to just put it in the hair there. Okay, absolutely rubbing it in the hair there. Nice and thorough. Nice and thorough. You know what I'm saying? You know what I'm saying? Every single millimeter covered. We leave no millimeter behind. Cover absolutely everything. Absolutely everything. Every single strand of hair. Moisturized, gelled, and styled to perfection. That's what happens when you come to the hood doctor today. The hood barber. You know what I'm saying? Multi-talented. I can do basically anything. I can do basically anything. Okay, excellent. Wow. Wow, that's looking good. You're looking good, homie. You're looking absolutely good. God damn. I wouldn't mind a piece of that myself, you know what I'm saying? Right. Okay, next thing I wanted to do for you. Yes, I did notice actually when I was up close that you have a monobrow problem. It's okay. Nothing to be embarrassed about, okay? Happens to a lot of men. It even happens to myself. You can't tell obviously right now, but I do. I've got an absolutely stonking monobrow under here. I'm basically a caveman. So allow me to use some tweezers to get rid of that monobrow to shape your eyebrows, okay? This is another essential thing, okay? The ladies, they don't like a monobrow. It does not look good. Okay, let me get the tweezers. Let me get them. Okay, here we go. Are you ready? It's gonna be painless, honestly. Pluck, 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 pluck. Okay, I see. Pluck, 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 pluck. face a bit of a shave as well, okay? Because it's in to be smooth faced at the moment. I don't know if you're aware of this, but it's in. Yeah, I keep up with the fashion. I know about it. I know the streets. Okay, now I've got a special little shaver. It's a magical shaver, and it will leave you so flippin' smooth. You'll be feeling your face all day long. People are gonna think you're a freak. People will think you got problems because you'll just be like, oh baby, yeah, they're so freaking smooth. I love that shit. I love that shit, baby. Okay, so let me get my shaver. Look at this. Look at this technology. 3 movable dimple pads. Dimple pads, that's what they're called. That's what the scientists named them. Dimple pads, okay? They match the contour of your face. The contour. Oh, wow. What a time to be alive. This technology is incredible. Are you ready? Let's go. Me. Oh my goodness me. Let me have a feel of that, please. Oh Lord, they're smooth. Oh Lord. Lord above, they're smooth. Good gracious. Heavens above. Oh, you're looking good right now. You're looking good right now. Okay, so actually, I believe that's it. I believe that concludes our haircut today. Okay, you came in looking all frazzled and wild, and you're gonna leave today looking like a piece of A-grade meat. You know what I'm saying? Right. Okay, so now the payment. Typically, I've been asking for $100 for my sessions with you today, but obviously that was just a haircut, so I'm going to ask for $100 again. Okay, if you could give me $100, please, that would be great. Excellent, thank you so much. That's why I like you. That's why I like you. You don't mess around. You don't mess me around at all. You come in, you tell me what you want, I deliver the service, you deliver the goods. Okay, a lot of mutual respect here, and I appreciate that. I appreciate that a lot. Okay, so thank you so much. Hope you enjoyed yourself today, and I know you're going to enjoy that haircut and that look. Okay, be careful. Be careful when you leave this place, because you're about to be swamped by the ladies. You know what I'm saying? You're about to be drowning in pussy. Okay, absolutely drowning in it. Alright, I'll see you again